There's a lot of tears this morning. But you know who's smiling? Charlie.
At the last infusion of a drug that's intended to slow her terminal disease, 9-year-old Charlie is somehow all smiles.
Finding out it's her last infusion the day before is very difficult. I think it's a little heartless. We could have used some time to process and prepare.
Following a review of Charlie's coverage for Brineura, the expensive drug that stabilizes Batten disease, yesterday the province pulled its funding.
There is no evidence to support changing the discontinuation criteria or to support the ministry continuing to provide coverage for Brineura given the advanced condition and advanced stage of Charlie's condition.
The Ministry of Health says Charlie's motor language abilities have dropped below a threshold that now renders the drug ineffective.
Regardless of what the scale and the scores might say, this child is still, without a doubt, benefiting from this drug.
Dr. Anika Whiteman, a Batten disease expert, says this is one of the first instances globally where funding has been pulled, criticizing the Canadian Drug Agency and the province for leaning in on old data.
The current discontinuation criteria that they're speaking about in this review are based on old clinical trial thresholds. It's not based on the lived experience or new real-world data.
Charlie's mom, alongside others, have reported the drug still helps control seizures, frustrated that the science hasn't caught up with lived experience.
Our children are the living proof that this medication is doing a lot more than its original intention.
Too expensive to fund on their own and unsure if they would even be allowed access to it. Now, Charlie's death has been fast-tracked.
Her right to live has been taken from her. It should be always, at the end of the day, it should have always been the decision of her medical care team and her family and Charlie. And none of that has happened here.
It's not an easy death. Lori Brown with the Batten Disease Support and Research Center calls it cruel.
It's not a gentle decline. It's unimaginable. It's painful. There are seizures. There are muscle contractures. There is food intolerance. There's just a shutting down of the body's systems that is in no way kind.
At her last injection, Charlie's mom is steeling herself.
And I'm very sorry to my daughter. She's being let down.
For the heartbreak to come.